I'm Ray Jouett. By means of introduction, I'm a practicing neurological surgeon in Little Rock, Arkansas. And it's been my privilege to work with Dr. Robert Watson in the practice of neurological surgery for 25 years. At the time of this interview, also, it being July 31, 1990, I think it proper that we express to the American Association of Neurological Surgeons that we're indeed pleased that Dr. Watson has been asked to participate in this series. In our preparation for this interview, Dr. Watson referred to himself as being an obscure journeyman neurological surgeon. And I asked the question of why he should be asked to participate in this series. It was my opinion to Dr. Watson that rather than being looked upon as an obscure neurosurgeon, that he in the eyes of most people was a pioneer neurosurgeon, that he had much to add to the history of neurological surgery, and also I think it would probably be of interest that at the time of his training and at the time that he entered practice, of that number of neurological surgeons at that time, there's probably no more than 10 who are living today, that being 50 years ago. It is also my assumption that the reason for Dr. Watson being asked to participate in this series is that he is indeed looked upon as a pioneer neurological surgeon in a portion of the country that had previously been devoid of neurological coverage. At the time Dr. Watson began practice in his home state of Arkansas, citizens of Arkansas had to journey quite a distance to receive neurological care. Dr. Eustace Sims and Dr. Francis Murphy were practicing in neurological surgery in Memphis. Dr. Furlow and Dr. Sachs were practicing in St. Louis. Dr. Anderson was practicing in New Orleans, and in Oklahoma City was Dr. Harry Wilkins. So a distance of anywhere from 150 to 300 miles must be traversed for neurosurgical care at that time. As suggested by this interview, it will deal heavily with the activities of a neurosurgeon who pioneers in his own state, which began in excess of 50 years ago.
Thank you, Dr. Jouett. I too want to express my appreciation to the American Association of Neurological Surgeons for asking me to participate in this series of interviews. I feel that my interview should be directed primarily to that period of time shortly before and soon after World War II, a time then such as existed is no longer to be had by the present day neurosurgical trainee.
The neurosurgical training we'll look at in detail shortly, but before we move in that direction, let's get some biographical information that we need to move with first. Tell us a bit about your early life.
Thank you, Dr. Jouett. I was born and reared in the small town of Mena, Arkansas, located in western Arkansas, a town at that time with a population of about 500 people, 5,000 people. My father had come to that part of Arkansas in 1896, at a time when the town was first being, the town site was first being laid out. His first venture in business was as a storekeeper, serving the people from a tent, because at that time no buildings had been were to be had.
Very little permanency had been built at that point, huh?
Yes.
Did you have brothers and sisters?
I had 3 sisters, each of whom had a college education and entered into the field of education, teachers.
Tell us about the early years of your education, which I gather began in Mena.
I was educated in the local schools there. Following high school, I went to college at Emporia College in Emporia, Kansas. I went there because of economic reasons. I could live with a married sister, and that was a big factor because at that time the economy of the country was not good at all.
So you chose to go to Emporia out of Arkansas, not for academic reasons, but for economic reasons.
That is true.
Tell us a little bit about the college at Emporia when you were there, and what do you remember specifically about that area, that time?
Those were the happiest days of my life, most carefree. Seemingly didn't have a worry in the world. I took whatever courses appealed to me, whatever might be of interest to me, and for the first 2 years, one might say that I simply went to college. My first interests were in general business education. From that, I switched over into pharmacy and eventually into pre-med studies.
When did you decide that maybe medicine held some interest for you?
I had passed my state pharmacy examinations and was working part-time as a practicing pharmacist. And in the course of my work, one day a youngster came in, a little girl, some 8 or 9 years of age, had a mildly lacerated hand, and I bandaged it up. And I realized at that time that I received more pleasure from taking care of that little girl than I would have received had I sold a sizable lot of merchandise to some well-to-do customer.
Medical school, where did you go and why did you go to that particular school?
I was accepted at the University of Kansas and also at the University of Arkansas. Again, for economic reasons, I came to Arkansas and entered medical school in the early fall of 1931.
Did you begin working immediately after you entered medical school?
Not immediately. I found medical school to be a rather trying and harrowing experience.
Well, tell us about some of those things that you remember.
Well, for example, the first day of medical school, the faculty told us that 1 out of 3 of you young men are going to fail. And a third of this class will not graduate from medical school. It turned out that was very much the case, in that as of a beginning class of 52 students, eventually only 29 of us graduated.
The psychological mood of the class would have been what?
Fear, apprehension and fear. We were always fearful of our opportunity or of our likelihood of finishing medical school.
So you were one of the 29 to graduate, and where did you do your first internship?
At that time, there were no matching programs for interns. It was a rather haphazard matter of choice. One might learn from some earlier graduate. One might have information on the bulletin board of the medical school, or one might find applications on the mail table in your boarding house. Such was my situation. I found an application that appealed to me from Detroit Receiving Hospital in Detroit, Michigan. That is the only application I made, and I chose this because I felt that I should, first of all, broaden my education. Number two, I should go to a larger working area. And number three, I ought to go to a different economic environment. And that's what prompted me to go to Receiving Hospital in Detroit in 1931.
Tell me something about the Receiving Hospital when that you remember. You were there, what, a year?
Yes, I was there a year. I had a rotating surgical internship. The hospital was not large by present-day standards. It was maybe 350 or 400 bed hospital with some 18 or 20 interns and staff members, intern and resident members. Some 8 or 9 specialties were represented at that time in that program.
Was it during this period that you became interested in neurological surgery, during your intern period?
Well, like every intern, I was fascinated with each service, whatever I might happen to be on. And early in my internship, while working in the emergency room, a child came to my care, again a little girl of some 8 or 9 years of age, and she had been struck by an automobile that morning on her way to school. When I removed her bandage, I saw something strange, something I'd never seen before. I saw raw brain tissue, and that was my first introduction to caring for a neurosurgical patient. At that time, there were only 2 neurosurgeons available to the Detroit Receiving Hospital. Dr. Frederick Schreiber was one of the doctors on call, and the other one was Dr. Steve Gurgen. Dr. Schreiber happened to be the one on call at that particular time, and his work kept him from getting to the hospital until late in that afternoon. But when he did come, I scrubbed and helped in the care of this child, and I took care of her during her period of recovery in the hospital. So it was that time that I had my first introduction and first experience with care of neurosurgical patients.
Why do you think that particular incident remains in your mind so firmly even today?
I remember it so well because at that time there were only 2 neurosurgeons available in the city of Detroit to serve the receiving hospital. The main thing, though, that stood out in my mind was this was an instance in which I could do something to help someone else. I could help save a life by doing so, and I think that was a big factor in my eventually going on into neurological surgery.
At that particular point, obviously there were neurosurgical programs. Did you investigate a number of programs before you decided to seek a particular place?
Well, first of all, because of my interest in neurological surgery, I was happy to scrub up and help the attending neurosurgeons whenever they came to to the hospital. And it's only human nature that some interns are going to avoid those 4 and 5 hour long operative procedures, but I was always anxious and willing to help, and for that reason I was asked to help, and that was a big factor in influencing me to eventually go on into neurological surgery. In the August issue of the Journal of the American Medical Association, in the educational number for the year 1935, there were listed only 6 training programs in the United States in the field of neurological surgery. Those programs offered a salary of anywhere from $15 to maybe $40 or $50 a month. There was one exception that did offer as high as $100 a month salary. I don't recall how many I applied to, but I do specifically recall writing to Dr. Harvey Cushing. It's interesting how naive a young man could be at that age, because I assumed all I'd have to do would be to take a year of training, and then I'd be prepared and capable to go out and practice on my own. Dr. Cushing, I wish I still had his letter. He very graciously told me that his service was committed for the next 3 years, and that took care of that question. But in New York City, there were 2 training programs that were accredited at that time. One of them was at the Kings County Hospital under the supervision of Dr. Jefferson Browder. Dr. Browder was a native Tennessee man who did neurological surgery at the Kings County Hospital at that time, and he told me that he would have a place for me as an intern on the service if I wanted to come and do so for the first year. So that was my selection. On coming to Kings County Hospital, I was told that my salary would be $15 a month, that I would have room and board and laundry and one other privilege which escapes my mind. But there was a weak spot in the situation in it. The budget for paying the interns had exhausted, and they didn't have any provision for paying me, and I reminded them that I did have a contract and I had to be paid. So we compromised by them assigning me to the hospital kitchen help budget. So each month I would go down there and line up with the other kitchen help and draw my $15 check.
Let's talk about Dr. Browder a bit. Tell us a bit about him.
I will always have the greatest of respect for his honesty and his integrity and his respect for his own good name, and that was a factor that was always an influence with me from then on.
Did you have a working contract in those days?
Our working contract was verbal and very brief. Sometime along the spring of the year, he would turn to me and he'd say, "Watson," and I'd say, "Yes, sir." He'd say, "You've got a lot to learn, haven't you?" And I'd say, "Yes, sir." He'd say, "I think you better stay another year." I'd say, "Yes, sir." And that was our working contract.
Touch on his personality. Was he a taskmaster or what?
He was a taskmaster of the utmost degree, but he expected everyone else to work as he did. He worked around the clock, and he expected others to do so. I remember one time I pleaded with a bereaved husband for an autopsy on his deceased wife. And finally, we compromised by my agreeing to do that in their own home with the husband awaiting in an adjoining room. And for that activity, I received neither praise nor criticism from Dr. Browder. He just expected that I should always do the utmost in whatever my responsibility might be.
Did you have vacations during your period with Dr. Browder?
There were no vacations, there were no days off, there were no weekends off. One is expected to put in the full year's time at work.
I presume you had conferences comparable to the training programs of today, the different activities
Oh yes.
that prevailed now as then?
Our death conference at 8 o'clock every Saturday morning was something certainly to be respected. Though we might have been working in the emergency room all night, we were still supposed to be there in a clean uniform with freshly polished shoes at 8 o'clock in the morning for a death conference that might last on into the full of the morning. Dr. Browder always looked upon a death on the service as being a part of the physician's own responsibility. And I well recall many times in death conference he would say, "Never mind the excuses. The patient's dead, isn't he? There's nothing worse than being dead, is there?" That was his approach.
I can remember that when I was a resident, and I have heard of it much before that a resident was not looked upon favorably if he was married. Was that a problem with Dr. Browder?
Oh, no, that wasn't any problem with Dr. Browder. He saw that without any hesitation, in that he would never consider the application for residency from one who was married. I well remember one time, I remember exactly where we were. He stopped and asked me about a certain young man with whom I had interned in Detroit. When he told me who he was, I said, "Dr. Browder, there isn't a finer, more capable young man anywhere in the country than this young fella, and I would certainly recommend him without any hesitation whatever." His next question was, "Is he married?" I said, "Yes, sir." His answer was, "Humph, let's make rounds."
So marriage was not a problem for him.
No.
The responsibility of a resident becomes a point at which everybody wants at some point. Most people want it earlier than they get it. We've also heard other programs that the resident rarely ever had responsibilities. When did Dr. Browder start you as a responsible resident, allow you to be involved in the care of the patient, operating and management?
Well, from the beginning, I would serve either as a second or assistant or a first assistant to Dr. Browder. After about a year's time, I was a first assistant to him. And when the time came that he thought that a resident was sufficiently trained and capable of accepting full responsibility for that care, for that patient's care, he would turn responsibility to the patient. I well remember it was one New Year's Day. We were in the operating room. He had, it was 18 months to the day since I'd started my training with him. He had finished draping the patient, and he abruptly turned to me and says, "Watson, you know what to do. You go ahead and do it." And with that, he walked out of the room. And he was one who might open the door and make some inquiry as to what's the progress of your operation, what are your operative findings, how are you getting along, things like that. But he was never one to stand at the shoulder of a resident and say, no, do it this way, no, do that way. He left that responsibility fully up into the hands of the resident himself. And once he felt that an individual was well enough trained to accept full responsibility, he would very completely turn it over to the resident.
How many men did he have on the staff, on the neurosurgery staff, that was a part of the teaching program?
Dr. H. Russell Myers. Dr. H. Russell Myers is a character within himself. He was on the teaching service, and a general surgeon from out in the city by the name of Richard Grimes was on the service. And then Dr. Floyd Bragdon was an early resident before me. Dr. Frank Turney was a resident later on with me. We had 4 interns on the service and about 120 or 125 beds, patient capacity for our service. And fortunately at that time, you could keep a patient in the hospital for as long as you wanted to. And I well remember an old boy by the name of O'Rourke. We kept him on the service for 4 years because we wanted to be sure and get an autopsy.
I conclude then that after 6 years, Dr. Browder felt that the time had come and that you could cut loose. Is that right?
Yes. At that time, he told me that he would offer me a place in his own office, sharing his practice with him. He told me he would assure me of a facility staff appointment at Kings County Hospital, at the Brooklyn Hospital, and also at the Brooklyn Methodist Hospital. And after having made that offer to me, he very abruptly said, "No, Watson, you're going back home. I wish I had." So with that blessing, I left to come to Arkansas.
So you came to Arkansas in the spring of
1942.
42. That's some almost 50 years ago. Did you have apprehensions about making that trip, starting a practice in a state that had never had a neurological surgeon?
Well, with a $200 used car, no heater, no radio, driving through a winter blizzard throughout southern Virginia and eastern Tennessee, 4-day trip, I had plenty of time for pretty deep contemplation on what the future might hold for me. It was on crossing the Mississippi River from Memphis on into Little Rock that I had other apprehensions. After passing just row on row of 2-room, unpainted, rough-timbered sharecropper houses, I had a pretty good concept of the stark economy that existed in Arkansas at that time.
Did you think that maybe I should turn around and go back and take Dr. Browder's offer?
Well, I thought of it, but that just wasn't in my makeup, so I'd started down here, so I'd come on down and give it a try.
On your arrival in Little Rock, what type of reception did you have?
I was greeted with the best of wishes and friendliness from the dean of the medical school and from the medical staff, and I learned that a letter had passed in transit while I was driving down here. The letter had gone to me in New York offering me an appointment on the teaching staff of the university.
So you had an appointment. What sort of terms did they have for you? What did they demand of you?
I was to have a 1 hour, one afternoon a week outpatient clinic. I was to have an hour a day every day of the school year for teaching purposes. I was to take care of the neurosurgical responsibilities at the hospital. I was to receive $100 a month salary and my room and board and laundry with living in the staff quarters of the intern quarters at the hospital.
You got started off well.
Yes, I did. And that same day, I received an appointment. I received an appointment to the Missouri Pacific Railroad Hospital as their district neurosurgeon. For that, I was to work in an outpatient clinic, and I was to have operating responsibilities for the care of the patients along the Little Rock Division of the Missouri Pacific Hospital. I was to receive $100 a month for my services, and I was also to receive a free pass on throughout the Missouri Pacific railroad lines.
Very nice beginning. Did you use the your pass on the railroad very often?
Oh, that was quite an achievement, because automobile traffic from city to city was rather difficult in those days. Most of it was traffic by train, and it's very interesting that soon after I received this railroad pass, I had a telephone call from Dr. Eustace Sims in Memphis. And Dr. Sims advised me that he was to be on the examining board at the coming meeting to be held in Chicago in the next few weeks' time. And it was a very friendly gesture on his part. He thought it would be well for me to meet him in Memphis and ride with him on the Illinois Central on into Chicago, as he stated, to become better acquainted and have a chance to visit on the way up there. And at that time, I committed the most brazen, the most grave, and the thoughtless error that one could commit, in that I refused his invitation. And my frugality, I explained it to him, but my frugality prompted me to tell him that, no, thank you, Dr. Sims. I have a pass on the Missouri Pacific Railroad. If I use that pass, I'll save about $50, and I thank you for asking me, but instead I'll just meet you in Chicago.
You're lucky that was Dr. Sims and not somebody else on that board.
Yes, it was.
Tell me, before we move on, do you have a recollection that you would like to share with us about Dr. Sims? You were only 130 miles apart, and as the years went on, that space got a lot closer with the travel.
We were always very close. He was always very helpful to me. I made many visits to Memphis, and on occasion I would maybe take a patient over for consultation with him. Also, I had a very pleasant working relationship with Dr. Sachs and Dr. Furlow in St. Louis. Dr. Harry Wilkins in Oklahoma City was a childhood acquaintance, because he was born and reared in Mena, went to school in Mena, and was in our home many times. He was always helpful to me. So I had a pleasant relationship with all of those people. I remember On one occasion, I told him of a young man who had a very serious neurosurgical problem, and I thought that maybe I ought to send the patient on up to Dr. Sachs, but transportation at that time was difficult. There were no air ambulances, or wasn't any helicopter service, and there wasn't any roads that were sufficient to justify an ambulance trip. So Dr. Sachs, I guess according to his way, said, well, just have him to hire a special car on the train, send him up that way. I will remember that comment from Dr. Sachs.
Tell us a bit about the working arrangements that you eventually developed in Little Rock.
Oh, this was entirely virgin territory. There were no facilities at all for caring for a patient. And by custom, they couldn't be cared for here. I well remember when I came, I was impressed with the wealth of benign material that awaited me. Trigeminal neuralgia patients, benign brain tumors, meningiomas, astrocytomas, spinal cord tumors. There was just a wealth of that waiting to be cared for. There was some, I had good cooperation from all referring doctors. I had excellent cooperation from the medical school, and I had every opportunity to serve these people that one could ask for, except it didn't have any facilities provided for it. There were no customary operating room facilities for neurosurgery available at that time. A headrest at first had to be resorted to by use of a pair of sandbags. Later on, I did go to the Arkansas Trade School and have them to build for me a headrest that was most practical and served me well for a period of maybe 40 years' time. There were none of the customary instruments for neurosurgical procedures were available. I had to acquire a makeshift assortment of thyroid retractors and mastoid retractors and Gillespie retractors and such as that. Lighting was very primitive. There were no arrangements for shading pulling the shades on the operating room windows. Light was a problem at that time. But by makeshift arrangements, I got along very well. Each time that I visited somewhere, whether it might be Memphis or St. Louis or Cleveland or Manhattan, wherever I might go, I was always impressed by the ingenuity of the neurosurgeon of that time, because surgical supply houses did not provide headrests and other such equipment, so that the headrest that doctor used and the operating table attachments and the headstands and other such facilities were the brainchild of the neurosurgeon and of the maintenance foreman in his repair shop. They were all handmade.
While we're talking about the physical plant and things that you were doing, what about the number of procedures? I know you've done many procedures for trigeminal neuralgia. Obviously, that was one of the things that was waiting for you. Meningiomas, I'm sure, spine problems were present at that time that were waiting. Likewise, had not gone away. Is that true, that you had a lot of that type of material initially?
There was just an unbelievable wealth of such material, and the trigeminal neuralgia situation stand out in my recollection. My first private operative procedure in private practice was the postganglionic section of a patient with trigeminal neuralgia. During the first year I was in practice, I did 29, in the first 2 years that I was in practice, I did 29 postganglionic fifth nerve sections. As I mentioned, the first one I did was in the private hospital. The people had been just simply suffering with that dilemma. At that time, they resorted to inhalation of trichloroethylene or maybe some manner of snake bite serum, but surgery was something new to this area. And many of those people that I operated on had been suffering with trigeminal neuralgia for 6, 7, 8 years before they finally gravitated to my care. I recall that in my early group, one patient was 85 years of age, another was 92 years of age, and long-standing suffering with trigeminal neuralgia had been just a sort of a sign of the times up to the coming of neurosurgery to this area.
What about anesthesia?
Anesthesia was very primitive. It was archaic. It consisted mostly of open drop ether anesthesia. Many cases were done under Novocaine local infiltration supplemented by Averton rectal anesthesia. Many times morphine was supplemented in those situations. Particularly though the lack of a skilled anesthetist was quite a problem, and at that time intratracheal anesthesia had not been introduced. It was all a matter of open drop anesthetic.
Let's move back just a bit to the everyday activities that you dealt with and the cost of things, your living expenses, your office expense this many years ago. What do you remember about that?
At the beginning, and at the invitation of one of the Little Rock general surgeons, I shared his office space with him. My portion of the cost of our office space was $30 a month. He had a young lady working with him who served as a typist, a receptionist, a bookkeeper. My share of her salary was $7.50 for a 5.5-day week.
Cheap, very cheap.
As for expenses, as I said, my room and board and laundry was provided as part of my hospital salary. I wrote myself a check. My total expenses wouldn't exceed $100 a month. My total office expense would not exceed $100 a month. I wrote myself a check each week for $10 for general incidental expenses, and I also put $10 a week in a postal savings account, and that was my beginning.
Were you able to spend all that in one week? The I guess we need to kind of maybe summarize some things here now, and then we'll move into a new thing. How would you summarize the favorable and the unfavorable aspects of what happened to you coming as a pioneer into neurosurgery into Arkansas?
Well, first of all, there was a genuine welcome from all the physicians. There was a wealth of material awaiting for me to come and help take care of them. The physicians were welcome in their greetings to me. There were one or two exceptions in which I think they meant well by doing so, but they told me to the effect that I could never establish a neurosurgical practice in Arkansas because they said, to use their words, we only have, quotes, 4 or 5 brain cases a year, and they all go to the Mayo brothers. So some didn't think well for me to come, others did. That was a time when there were no peer review committees, there was no government foundations for medical care. Everything was on a person-to-person, patient to physician relationship. In each instance, I would talk to the patient regarding proper fee. I had a pretty good concept as to their ability to pay, judging by my knowledge of the general economy of the state. I always made the point to them that I would take care of them under any responsibility. And there were so many highly favorable factors in my coming to Arkansas to practice. There were also some unfavorable ones.
Well, you mentioned that there was no Arkansas Foundation, there was no peer review committee, there was no third-party intervention here, and of course those all came later. But did you have malpractice insurance at that point?
Before we get to malpractice, so there was one other thing. The stay in the hospital was determined by the judgment of the physician and by the need of the patient. There wasn't any third-party source telling you you only have 3 days to get them out of the hospital. All right, now the malpractice.
Well, while you're on that, let me ask you this. Do you remember that any hospital administrator ever came to you and said, Dr. Watson, you've got to move that patient out of this hospital?
That was the most unlikely thing that one could conceive of. The hospital was dedicated to the care of people, and they'd always keep them regardless of their ability to pay once they had to come to the hospital. And there were other agencies that would help me so that I could always arrange some manner of charitable care for a patient through some source.
Now, malpractice.
All right. The idea of a malpractice suit of a personal character brought on by a lawyer was just an unheard of thing of that past, of that time. And any lawyer who risked a malpractice suit against a physician also risked a long-standing blemish on his good name. Malpractice problems were so rare. My malpractice insurance for the first year was $29 a year.
Unheard of.
Now, I judge, you know better than I do, but probably we're talking about $20,000 or $25,000 malpractice locally.
Well, in this state, neurosurgery, it's about 37 for each individual. Now you had you had meningiomas and you had other benign lesions and the spinal cord tumors. Did you have trauma that you dealt with?
Well, the trauma of that time was of a different character. The compounded pressed skull fractures were more likely due to somebody having been kicked in the head by a horse or hadn't been struck in the head by a sharp instrument. The trauma of that time was just kind of a sign of the times. There's one other type of problem that I should mention, because that was the subject of brain abscesses. Brain abscesses were looked upon then as being very seasonal. In the late fall, we had frontal and temporal lobe abscesses secondary to frontal sinus infections that came on as a result of swimming back earlier in the summer. Then in the late spring, we had brain abscesses secondary to middle ear infections that had come on in the midwinter time, and eventually some 6 or 8 weeks later would manifest themselves as brain abscess. They were customarily cerebellar in character. One other thing I didn't mention about the meningiomas. I experienced 3 intraventricular meningiomas in those early days, and many years passed that I didn't experience another one. I don't know how uncommon they are, but 3 in a period of about 5 years was rather uncommon to me.
Fee schedules. What do you remember about the fee schedule of 50 years ago?
Well, again, that was something that was discussed with the patient because, as I said, I had a pretty fair concept of the economy of that particular geographical area of the state. So we discussed the fee. We determined their potential ability to pay. A routine history and detailed neurological examination at that time, a charge was made of $15, and some people thought that was a little bit high. The customary charge for a laminectomy for spinal cord tumor was $125 to $150. The charge for craniotomy for a tumor was $500. Those were the customary charges made at that time.
Was fee splitting ever a problem that you remember 50 years ago or even later?
I had cause to suspect that it existed sometimes in certain situations, but I was never openly confronted with such in my practice. I might have had some subtle suggestions in which they might say, "Would you like me to scrub up and help you?" And my answer would always be, "No, this is a long, trying procedure. I don't want to wear you out. I think it'd be far better if you sat with the family and gave them reassurance rather than to scrub up with me on this operation."
It used to be the custom that frequently the physician would bring a patient to see the specialist. Did that ever happen to you?
Oh yes, that was common procedure. And further back from the boondocks, the more likely this procedure was to happen, in that after the examination or the treatment had been completed, the referring accompanying doctor would oftentimes call me aside and in private would draw from his pocket a roll of bills and say, "Now the patient wants me to settle with you about this, your charges, I'll just go ahead and pay you now, and then I can settle with the patient later on, afterward. So the conclusion is kind of left up to you.
Time is short, and we need to bring this to a close. I'd like to ask you about three people. Did you ever have the privilege of meeting Dr. Cushing?
I had correspondence with Dr. Cushing, but I never met the man. I do recall, though, it was in the fall of the year, I believe it was in about 1937, in the operating room at Kings County Hospital. There was discussion at that time that Dr. Cushing had died that day or the day before. I never met Dr. Cushing. I did meet and come to know Dr. Dandy fairly well, because Dr. Dandy would oftentimes visit with Dr. Browder, and I got to know him reasonably well.
Is there any other personality that stands out in your mind that you came in contact with in Dr. Browder's era, especially in New York, for instance? Was there anyone there that you remember? I'm thinking of one Tennessean that was transplanted to New York.
Dr. Joseph E.J. King.
Yes, Dr. King.
Dr. King and Dr. Browder were both from eastern Tennessee. They were both good friends. They discussed their problems frequently, and I guess that Dr. King knew more about the treatment of brain abscesses than any other man of his time. Now, Dr. King was a general surgeon, and but he never would give up he never would give up general surgery to go full time into neurosurgeon. He never would give up full neurosurgeon surgery to do full time in general surgery. He did them all, and many times I would visit him and watch him operate, and he was dedicated to the care of a brain abscess. And if I happened to call him at 11 or 12 or 1 o'clock in the morning to discuss a case with him, he'd say, I'll be right over, Watson. I'll come on over and see him with you. And he'd help me in the dressing and in the care of that patient. And he was a past master at the art of marsupialization of brain abscesses.
Very quickly, you've had lots of wonderful accolades that have come your way.
Before I leave Dr. King, though, there's one other thing I should say. He was accepted as an honorary member of the Southern Neurosurgical Society because of his interest in neurosurgery. And I made rounds with him. And in one bed, maybe there'd be a brain abscess. In the next bed, there might be a thyroid. In the next bed, some abdominal surgery. But he mixed his neurosurgery right along with his general surgery, and it is said that he was offered a membership in the National Neurosurgical Societies if he would just give up his general surgery, but he wouldn't do it.
Many accolades have come your way.
Well,
The Distinguished Service Award of the Southern, I remember. Other things that you want to briefly tell us about?
Several stand out, particularly one from the University of Arkansas at Fayetteville, honoring me as a distinguished graduate. Another from the University of Arkansas School of Medicine, naming me as a distinguished graduate. I have a plaque from the university acknowledging my 27 years as a clinical professor of neurological surgery. I have another plaque from the Arkansas Crippled Children's Program acknowledging 45 years of surgery, of practice. And I have certificates of of having been president of the Neurosurgical Society of America, and as you mentioned, of the Southern Neurosurgical Society, and from them I also have a plaque of honorary practicing neurosurgeon as presented by the Southern Neurosurgical Society. So those are kind of the outstanding recollections I have.
Dr. Watson, it's been a pleasure.
Dr. Jouett, I want to thank you. Now, you avoided, I passed up, I left to the last, the award that I appreciate most of all. And that is from you and the other members of our group, by which you furnished and provided for the Library of the History of Medicine at the University of Arkansas School of Medicine. Also, we both want to again express our appreciation to the AANS for having asked us to participate in this videotape recording. And thank you again, Dr. Jouett.
Thank you, sir.
And thanks to you all.